Reporting live in Las Vegas, Nevada, this is Mari Turner, your news anchor and host. There has been an outbreak of Streptococcus pneumoniae, unfortunately, that is spreading across the city at a very fast pace. Locals are advised to get vaccinated as soon as possible to fight this as much as they can. If you're unfamiliar with this bacteria, it causes both non-invasive and invasive pneumococcal diseases. This bacteria is also a part of the normal flora of your nasopharynx, which is also the lower part of your respiratory tract. This bacteria also causes diseases ranging from ear infections to sinus infections and bloodstream infections. Some things to look out for with invasive and non-invasive pneumococcal diseases include pneumonia, which is a lung infection. We have sinusitis, which is a sinus infection, meningitis, which is an infection of the lining of your brain and the spinal cord. In this segment, we will have Trevor Smith, who is an expert that will inform you on the reservoir and symptoms of this infection of bacteria. We have Dr. Dakota Rossi, who will give you information on the transmission and treatment to avoid getting this bacteria and disease, as well as how to be aware and save yourself for future references. I'm going to pass this to Trevor. Hopefully you can hear me, Trevor. Can you hear me?
Yes, I can hear you, Mari. I'm here at Green Valley Ranch Casino, where many guests and employees have reportedly developed cases of streptococcal pneumonia. Now, the streptococcal pneumonia bacteria isn't a rare thing out in the world. And even though its reservoir, which is just a fancy way of saying a host organism where a pathogen can live and it doesn't damage the host, its reservoir is not found in nature, like in the soil or in insect populations. They say around 27 to 65% of children and less than 10% of adults are carriers of the bacteria in their nose at any given time. So it's very possible that a child is responsible for this outbreak. This bacteria needs extensive and complex interactions with nasopharyngeal microbiota to thrive. Scientists describe this sort of relationship as commensal, and it's not until the bacteria can invade sterile tissue that problems arise. Carriage duration typically lasts for weeks to months, so the person who infected everyone is most likely still a carrier. Local public health officials are saying to be on the lookout for symptoms if you have visited the casino within the last 24 hours. Symptoms like difficulty breathing, cough, chest pain while breathing, sputum production, fever, chills, light sensitivity, and ear pain. Public health officials have also noted monitoring vital signs may be the most useful physical exam in diagnosing pneumonia. Health officials also want elderly people who may have been exposed to take extra precautions. They say the course of the disease may not show typical clinical patterns in the elderly. Generalized weakness, altered mental states, malaise can be the first clinical signs seen in the elderly population. Public health officials have also noted monitoring vital signs may be the most useful physical exam in diagnosing pneumonia. Abnormally rapid breathing, hypoxia, and fever in suspected pneumonia patients require further diagnostic evaluation, and these people should seek medical attention immediately. This is Trevor Smith reporting live at Green Valley Ranch. Back to you, Mari.
Thank you, Trevor, for sharing those facts. Now we're going to pass this to Dakota, who's going to introduce us to those transmissions and treatments.
Thank you. And I would now like to turn your attention to the slides on screen. So Streptococcus is both invasive and non-invasive. It would be considered invasive when it infects a part of the body that is generally free of germs, like any type of sterile tissue. If that does happen, it can be a life-threatening situation. Some diseases that it would cause would be like pneumonia, which is a lung infection, bacteremia, which is a blood infection, can also cause sinus infections, and meningitis. So as far as where this microbe is found, it's found exclusively in humans, in the upper respiratory tract. It is much more common in children than it is in adults. It should be noted that the microbe has a commensal relationship with your normal microbiome, assuming that it doesn't invade any sterile tissue. So the way this microbe is going to transmit from one person to another is going to be through respiratory droplets. Factors that are going to make this more likely to happen are going to be, if you're in crowded spaces, the season of the year, or if you already have an upper respiratory disease. So as far as symptoms that you're going to see coughing, fever, chills. Those are going to be pretty common. Elderly patients need to be extremely careful with this. They may not show typical clinical patterns. And as always, if you are concerned, always go see your doctor. So as far as treatments are concerned, generally we're going to start out with a broad spectrum antibiotic until we can narrow it down to a narrow spectrum antibiotic. Every 3 out of 10 cases are antibiotic resistant. And it should be noted that there is a pneumococcal vaccine. So if you haven't gotten that, I would highly recommend it.